Hello everyone. You're watching sqadia.com and I am Hammad Haider. Today our topic is the spinal cord injuries, in which includes the cervical spine injuries mainly. As we'll be discussing, we have three sections, and in the first section we are discussing the general aspects of cervical spine injuries. That is the cervical spine, what are its signs, symptoms, the patient presents with a cervical spine injury, what are the different imaging modalities we need to be doing when we need to get the x-rays done, especially the AP and lateral views of the cervical spine, how much exposure is there, and what is the role of CT and MRI in the cervical spine injuries, and should it be done straight away in a patient with a trauma or not. Then we will be discussing the diagnostic pitfalls in children, because unfortunately children sometimes do present with the ligamentous sprains and injuries without any radiological problems. Especially we'll be discussing the sqadia, that is the spinal cord injuries without any radiological abnormalities, which is very common, especially in the case of children. In the second section, we will be going through the upper cervical spine injury, and upper cervical spine includes the occiput, C1 and the C2, that is the atlas and the axis. In the first, we will be discussing the occipital condyle fractures, which may occur with associated with the high energy trauma. Then we will be discussing occipitocervical dislocation and the C1 ring injuries, that is the Jefferson fracture as well of the C1. And then we will be discussing the C2 injuries as well, that is involving the axis vertebra, that is the C2 traumatic spondylolisthesis, as well as odontoid process fractures of the C2. In the third section, we will be discussing an important entity regarding the cervical spine, that is a whiplash injury, which is actually initially the hyperextension, then hyperflexion mechanism kind of injury, which is associated with ligamentous sprains of the neck, and maybe although there may be not associated any fracture, but it would be very damaging, especially for the patient. We'll be discussing the clinical features, what are the differential diagnoses which come in the whiplash injury, its treatment, its progress, and the outcomes. Thank you very much. Keep watching sqadia.com.